This is QD Clinic. Hi, I'm Dr. Jack Cush, Executive Editor of RheumNow.com. QD Clinic is brought to you by RheumNow.live. Next week you can go to that website and actually register and look at RheumNow Live for free, on demand, at your leisure. Today's case is smoking and rheumatoid arthritis. So last week I saw this gentleman, 70 years old, has had rheumatoid arthritis since 2015, so about 3.5 years we're talking. His onset was symmetric polyarthritis, no nodules, no tenosynovitis, very high SED rate and CRP, very high rheumatoid factor, over 400, very high CCP, greater than 250, and yes, even very high 14.33 eta. So no, I didn't do CAR-P antibodies, but I'm sure they might have been high too. His diagnosis was real clear, real easy, could have made it from across the street. So put him on methotrexate, he did real well. But noted at that visit, that strange sort of hint of tobacco as I did an exam. Turns out that I didn't need to ask him about tobacco, but I did, of course. And he's a 2-pack-a-day kind of guy, probably for over 50 years. And said it was hard for him to quit. He was told at that visit, first visit, that smoking has been known to be a risk factor for rheumatoid arthritis and a worsening factor for rheumatoid arthritis. This has been known for over 25 years in the medical literature. And that I strongly advised he make an effort to reduce his risk. And now fast forward 3.5 years and he's still smoking, and turns out his arthritis is fairly well controlled. He started out with a CDAI score of almost 20, and he's been running somewhere between 1 and 6 the last few visits. So he's doing fairly well. He's happy with how he's done on just methotrexate and a PRN non-steroidal. But I keep bringing up the issue of smoking. So what do you tell someone about smoking? You know, it's sort of like telling someone to lose weight. No one ever listens to you, and it's a bit like badgering a patient. But you should know the research is actually really quite clear. Of patients who do lose weight, the number one reason why they lost weight was because their doctor convinced them to do it. So the point is, if not you, then who? So what do you tell them? Guess what? Smoking is associated with increased risk of lung cancer. Yeah, doc, but I'm 70 years old. I've been smoking since I was, 32. It also increases your risk of lots of cancers, including oral and head and neck cancers. We know it increases the risk of gingival disease, and we know gingival disease is another risk factor for severity and risk of rheumatoid arthritis. We know that smoking increases the risk of getting rheumatoid arthritis. Smokers versus non-smokers are likely to get rheumatoid arthritis. We know that smoking worsens rheumatoid arthritis. They're more likely to get erosions, nodules, extra-articular manifestations, damaging and disease and disability. We know that it somewhat hampers drug responsiveness, although inconsistently so. Not quite as bad as is seen in obesity. We know that smoking cessation leads to better outcomes in rheumatoid arthritis. That's sort of surprising. It takes several years, but that's been shown. So what's going on here is the people who are at greatest risk are those who have the shared epitope. The HLA-DR beta-1 alleles, previously called HLA-DR4, etc., that if you have that genetic risk factor, known to be the strongest risk factor for getting rheumatoid arthritis, it really goes into play in overdrive when smoke. These aromatic hydrocarbons are in play. It activates osteoclasts, it leads to Th17 cell activation and autoimmunity run amok. It leads to more autoantibody formation, which in the presence of smoking and the HLA-DR beta-1 allele increases the risk and the severity. It becomes a snowball that just won't stop, and it grows, and hence you get the risk. So this is associated with seropositivity and hence a prospective risk of even in someone who doesn't have the disease but might well get it if they continue to smoke. So again, you need to remind them of the facts and why you're worried about it. Well, I'm very impressed. While most rheumatologists are not very good at managing comorbidity, you know comorbidity, you worry about comorbidity, you assume someone else is going to manage comorbidity. Most rheumatologists actually do a fair amount of coaching and cajoling and begging their patients to stop smoking. What should you tell them? Number one, it's not easy. They know that. Tell them the success is really based on what is known, and what is known that you can't do it on your own. You need to join smoke enders or some kind of group, or do it with someone else who's also motivated to quit smoking. They probably need medication help, Wellbutrin, Chantrix, those kind of medicines, whatever it takes to get them over that craving part, especially for the first 3 months, if not 6 months. And then you need to tell them that, again, they need to continue to ask for help, and they need to surround themselves with non-smokers as opposed to smokers. Turns out that people who do quit smoking usually become sort of militant about not smoking and who they hang out with. Now, of course, smoking and drinking might be a good idea because it's the alcohol that could actually lessen the risk and severity of rheumatoid arthritis, but obviously the smoking negates all that. So going to bars is not going to help your rheumatoid arthritis. It's going to hurt it. So it's a tough job. If not you, then who? Remind your patients smoking is not just dangerous, it's going to kill their joints too. See you tomorrow.